here at the ISHRS World Congress in Berlin, and we have a special treat, an expert panel of hair transplant surgeons from around the world who are here to give us their opinions on some of their favorite treatments for both men and women. They're here to bust some myths for us, give us some advice for new surgeons, and their favorite takeaways from the conference so far. Let's take a look.
Okay, basically we offer a combination of oral, minoxidil and finasteride. Some patients prefer the topical, but usually we recommend the oral. Besides these medications, we also use the laser cap and a procedure in Brazil that we call MMP, that we use a tattoo machine to deliver the medication straight to the skin.
My favorite medical treatment for men, honestly, finasteride. But if you just do one treatment, you're already missing the boat, because multiple treatments together are what the science shows really work. Normal medicine, you try one thing, 2 weeks later you check, see what works, because you want to know what works. With hair, it takes a whole year. So you do everything all at once, throw the spaghetti at the wall, see what sticks. Like multiple modality treatments are always better. In conjunction, their effect is multiplicative, not just additive. So everything all at once.
I have a number of recommended hair treatments for men. The key is which one they'll use. Compliance is number one. Finasteride, giant fan of finasteride, did the clinical trials, helped bring it to market. Minoxidil, been using it since before Rogaine came out, mixing up Lonartan tablets in vehicle end to solubilize it. You go there, from there to oral minoxidil, topical finasteride, and from there you can go into growth factors, PRP, and things like that.
I do more personalization of medications and treatments for the men, so it's more according to the lifestyle. Sometimes I do genetic tests in order to do something more specific. But normally, I'd rather do hormone treatments and plus vitamins, and sometimes using something to increase the amount of blood on the scalp, like minoxidil or something like that.
So right now, I still think minoxidil is the best drug. Now, whether they can use it topically or if they won't use it topically and they're going to go ahead and use oral pills. The oral minoxidil works very well, and some people are very happy because even though they're treating their hair, their scalp, their eyebrows and their eyelashes end up benefiting from it. So it ends up kind of, hitting more than one target.
I have had a lot of success lately with microdosing oral minoxidil, and there's some new energy-based therapies. So energy-based therapies would be like the ultrasounds, that's an Almated, the ablative fractional, that would be like Folix or the Trichopat. But I'll tell you right now, nothing beats a light device. As long as the light, and this is always the trouble with women, as long as the light is able to get to the scalp, that's the trick. So if you can get a light device that's within the right wavelength, that gets light to the scalp, it's at home, it adds to whatever therapies you might also be doing, it adds to your minoxidil, it adds to your excellent shampoos, like a zinc pyrithione shampoo or something like that. And it just adds that extra layer, and it's easier than like putting something on your scalp when you have long hair.
One of the biggest myths in hair medicine has always been is that if you wear cap, you're gonna go bald. And it's kind of the opposite. People are wearing caps because they're going bald, but the caps aren't making them go bald.
Biggest myth in hair medicine, like a vitamin deficiency or biotin is causing your hair loss. It's not biotin. That's such bupkis. I get so sick of that one.
I would say that the big myth is that this is a simple surgery that could be done by everyone. People think that, and they make the mistake to go anywhere because they believe that, well, in case something goes wrong, I can look for someone else. What they don't know is that in case something goes wrong, maybe you have a problem you cannot fix. So this is the myth.
One of the biggest things at this conference that I've been struck by is the integration of surgery, medicine, nutrition, the microbiome of the scalp microbiome and of the gut, and how all that interacts and may influence your response to treatment and your progression of hair loss, in addition to the typically accepted genes and androgen approach.
So what I liked very much and can change my practice was the direction of the harvesting. Usually I used to harvest it from the bottom to the top, but I'm considering, after watching a video I saw from a Thai surgeon, I like that very much, going from left to right. And in this case, we don't waste time pulling the grafts because the technicians will pull simultaneously while we harvest. I will try that for sure.
My biggest takeaway, new friendships, totally. I love coming here, getting all of the excitement about hair, other people who are interested in hair, who are treating hair differently than I am, and just having these conversations. And I love meeting all the new people coming in here. That to me is number one.
Oh, good question. Well, to do a good surgery, you have to study, but that's not enough. You should watch and follow good surgeons, but also that's not enough. You should also have the hands-on, but it's very important to have the hands-on with someone you really trust and can offer you the best possible results. So it's a mix of everything.
Don't be afraid. It's a long curve in order to learn and practice, but don't be afraid. Just came to the conference, talk to people, go wherever it's possible to see and practice for the best.
Come talk to me, meet some new surgeons, make those connections. Part of what makes this whole thing such a wonderful experience is getting that network. And the pillars of collegiality in this society are real. I could go anywhere in the world, and I've been doing this for 20 years, but you'll find it very quickly when you actually start to meet people who are interested in hair. They're a real fun group, a little quirky, definitely a lot of fun. And that's the number one takeaway from being involved in the ISHRS is that collegiality pillar is really, it's key. It brings me back every year. I love this. It's like partying with 800 of my best friends from around the world every single time.
I can tell a new surgeon, advice-wise, is to get involved with something like the ISHRS. Colleagueship, the teaching, the research, the sharing here is amazing. You go from 0 to 60 so much faster than living alone in your garage trying to figure it out.